The middle range theory that I chose for my assignment this week is a theory of self-care of chronic illnesses with a focus on heart failure patients. The theory emphasizes that there are many factors that influence self-care in patients with chronic heart failure. The theory attempts to analyze those factors to come up with self-care interventions that will be more successful. Self-care is essential in managing chronic illnesses such as heart failure. Self-care is maintaining health through promoting health practices and managing illnesses. Self-care can be seen as an overreaching concept that's built from three different concepts. It's self-care maintenance, self-care management, and self-care monitoring. Those who report more effective self-care often have better quality of life, lower mortality, and lower readmission rates than those with poor self-care. According to the middle range theory of chronic illnesses, there are many factors that influence self-care and in chronic conditions such as heart failure. And they include experience and skills, motivation, cultural beliefs and values, functional and cognitive abilities, confidence, support, and access to care. Recent literature confirms that these are in fact relevant to self-care of chronic heart failure patients. Utilizing the middle range theory of self-care of chronic illnesses helps healthcare providers to understand the complex factors that impact self-care of heart failure patients, and it helps them to tailor the interventions to meet the needs and improve the quality of life and their health outcomes. This theory addresses the person meta paradigm of nursing by focusing on individuals' responsibility and their capabilities for managing their own health as it relates to their chronic illnesses. It emphasizes the patient's ability to engage in self-care activities and maintain health and manage their symptoms. It also focuses on enhancing self-care through education and support to provide effective self-care behaviors. The theory also acknowledges the meta-paradigm of environment on a person's ability to engage in self-care. It includes aspects such as socioeconomic factors, healthcare resources, social support networks, and the physical environment. It addresses the health paradigm by viewing health as a dynamic state that individuals have a responsibility for and can influence through their self-care behaviors. It also emphasizes the proactive management of chronic conditions such as heart failure to minimize exacerbations and improve overall well-being. It addresses the nursing paradigm of the nursing meta-paradigm because within the theory, nursing plays a crucial role in facilitating self-care behaviors. Nurses are responsible for education, support, and ongoing assessment of patients with heart failure. Nurses also act as educators. They motivate patients and they advocate for patients, which helps individuals develop the skills and the confidence they need to manage their chronic illnesses effectively. Two ways that this theory directly influences patient care in my work environment, which is med-surg, is that on med-surg we often get chronic heart failure patients. We're responsible for providing them with education and self-monitoring in the hospital and when they go home. Educational sessions for heart failure patients may include symptoms like edema, shortness of breath, diet management like low sodium diets, medication adherence, and self-monitoring techniques like theta weights. Another way that this theory applies is utilizing support interventions. The theory emphasizes the importance of social support and the role of healthcare providers in reinforcing positive behaviors and addressing barriers to self-care. So, as a nurse in the med-surg environment, I'm responsible for providing education and self-monitoring and utilizing supportive interventions to directly influence patient care. So that's how this theory applies in my work setting. Thank you for listening and have a good night.